1 in every 5 people, even if they're not smokers, experience breathing discomfort in cold air. You might start coughing every time you breathe cold air. Or your chest feels tight when stepping outside in winter. Or your throat starts burning or feels sore after being outdoors. And when we say cold air, we don't mean freezing temperatures. Even slightly lower than room temperature can trigger symptoms in some people. The most common signs caused by cold air are dry cough because cold stimulates nerve endings in your airways, throat soreness and irritation from drying airway linings and surface irritation, and chest tightness or breathing discomfort due to bronchial narrowing from temperature changes. Cold air also causes a runny nose. Why? Because when cold air touches nerve endings in your nose and bronchial tube, it activates the parasympathetic nervous system, triggering mucus secretion and narrowing of your airways. Suddenly, you're stuck with congestion, runny nose, and chest tightness, all usually kicking in within 10 minutes of exposure. Luckily, once you're back in a warmer, more humid environment, nasal congestion and bronchospasm typically fade away within 20 to 30 minutes. But sometimes the discomfort lingers for hours, even up to a full day. This condition, collectively known as bronchial hyperresponsiveness, happens without any infection at all. And here's the catch. Around 70% of cases occur during winter or colder days. The real trouble begins because this cold-induced hyperresponsiveness weakens your respiratory immune defenses, raising your chances of catching a common cold. Cold air dries your mucosal lining, creates tiny fissures, and slows ciliary movement, making it easier for viruses or bacteria to invade your cells. Sometimes, after being in cold air, you might even feel chills without any fever. It's your body's thermoregulation reflex at work. When cold, your vessels narrow to conserve heat, and when you step back into warmth, your hypothalamus takes a while to catch up, so you shiver and feel chilled, even indoors. Some people experience bronchoconstriction and breathing discomfort from even minor cold exposure, like being shirtless at normal temperatures. This sensitivity is strongly linked to asthma. In fact, more than 96% of people prone to asthma feel symptoms in cold air. It's also connected to chronic bronchitis, seen in about half of all cases. And have you ever noticed needing to pee frequently in cold weather? That's called cold diuresis. Blood moves from your limbs to your core, fooling your body into thinking blood volume increased. Your heart releases atrial natriuretic peptide, prompting frequent urination. Cold exposure can also trigger headaches, whether from chilly winds or even after eating ice cream. Rapid cooling, then re-warming of your sinuses stimulates the trigeminal nerve, sending signals that your brain interprets as pain. Here's another thing. If you bundle up too warmly, sweat soaks your clothes, and when that moisture evaporates, it chills you rapidly, worsening respiratory symptoms and bronchospasms. Now, how can we avoid these cold-induced troubles? Protect your mouth and nose with a mask or scarf when outside. Dress in layers of moisture-wicking fabrics, using synthetic or merino wool to keep your body dry. Staying dry prevents heat loss, which can otherwise leave you chilled and vulnerable. Always breathe through your nose. Covering your face traps warmth and moisture, pre-warming the air and minimizing bronchial irritation. If you're prone to asthma or serious bronchospasms, use a salbutamol inhaler about 5 to 20 minutes before exposure. It prevents bronchoconstriction in over 90% of cases, making it your best defense against cold-induced airway narrowing. And warm up intensely before stepping into the cold. A short burst of exercise raises airway temperature, reducing bronchoconstriction by over 80% compared to no warm-up at all. Indoors, maintain humidity between 30 to 50% to prevent mucosal drying. Evidence on infection prevention is mixed, but keeping moderate humidity may help reduce winter discomfort. Finally, during winter months, boosting your vitamin D levels cuts your risk of acute respiratory infections by about 30%, especially if you're already deficient. Cold air itself isn't the villain. It simply reveals underlying sensitivities, challenges your immune defenses, and tests your body's ability to adapt. Prepare wisely, protect yourself smartly, and stay warm confidently.